Did you know that chickenpox, a disease most of us think of as a childhood inconvenience, is actually caused by a virus that stays in your body for life? It's like an uninvited guest that never really leaves. Welcome back to Reem Healthcast. Today we are talking about chickenpox. So, what is chickenpox?
Chickenpox is a virus that belongs to the herpes zoster virus family. It is one of the contagious diseases, but people can't get infected twice in their lifetime. Otherwise, it is highly contagious to those without previous exposure to the disease in their life. Once the child or the person is infected, their bodies form a memory of the immune cells. That's why it rarely occurs twice in a person and is rare to infect older people.
The virus spreads through direct contact with the fluid from blisters, inhaling respiratory droplets, or even touching contaminated surfaces. What's wild is that you can spread it before you even know you're infected. The contagious period starts about 1 to 2 days before the rash appears, which is when most people don't even realize they're sick yet. And it stays contagious until all the blisters have crusted over, which can take about 5 to 7 days.
And speaking of the rash, let's talk about the symptoms.
They come in 2 stages. The first stage is what they call the dormant stage, where you might experience fever, fatigue, loss of appetite, and headaches. It's easy to mistake it for a common cold or flu at that point. Then comes the second stage, when the rash appears. That's when it becomes unmistakable. The rash starts as raised pink or red bumps, then turns into fluid-filled blisters that eventually crust over. The rash may be very itchy, especially when the blisters burst, as they contain irritative substances that irritate the skin. In severe cases, the rashes cover the whole body and involve the throat, eyes, vagina, and anus. And for kids, it's almost impossible to resist scratching, which can lead to secondary infections. That's why parents are often advised to keep their kids' nails trimmed and maybe even have them wear gloves at night.
Who carry an increased risk of developing severe chickenpox?
That's a good point. There are also certain groups of people who are at higher risk for severe chickenpox. These include healthy people older than 12 years of age, people with chronic cutaneous or pulmonary disorders, pregnant women who haven't had chickenpox before, newborns and infants whose mothers haven't been infected, people with weakened immune systems, smokers, and even those on long-term steroid medications.
What are the complications of chickenpox infection?
The complications can be serious. While rare, chickenpox can lead to bacterial infections of the skin, bones, or bloodstream, encephalitis, dehydration, or even death in extreme cases. There's also Ray's syndrome, a serious condition that may affect children who are on aspirin during chickenpox. After a week or 2 of chickenpox, they experience nausea, vomiting, loss of consciousness, and even a coma. It's a life-threatening condition that causes brain injury. That's why it's so important to manage the symptoms properly and seek medical advice. For most people, though, chickenpox resolves on its own within a week or 2, but there are definitely ways to make the experience a little more bearable.
What are the home remedies that might make chickenpox infection a little more bearable?
The following self-care measures should be followed to help relieve the symptoms of chickenpox, especially itching. Avoid scratching the itchy skin, keep it dry and covered. Apply soothing lotion and wear gloves on your hands, especially at night. Apply an ice pack to the lesions to help soothe the itchy feeling. And keeping kids distracted with books, movies, or games can help them resist the urge to scratch. Also, trim their fingernails. And let's not forget about hydration. It's crucial to prevent dehydration, especially in kids.
Prevention is always better than cure. How can we prevent chickenpox infection?
That's where the chickenpox vaccine comes in. It's been a game changer. The vaccine is given in 2 doses, one between 12 and 15 months, and the second between 4 and 6 years. For older kids and adults who missed the vaccine, they can still get it, but they'll need 2 doses at least 28 days apart. It's also worth noting that there are certain situations where the vaccine isn't recommended, like for pregnant women, people with weakened immune systems or have tuberculosis, or those who've recently had a blood transfusion or taken a shot of some other live vaccine, such as the yellow fever vaccine, the MMR, and influenza vaccines.
Right? And even though chickenpox is often seen as a mild childhood illness, understanding its symptoms, causes, and prevention methods can help minimize the risks and ensure a smoother recovery for those who do get it.
So whether it's through vaccination, good hygiene, or just being informed, there are plenty of ways to stay ahead of this virus. And that's something we can all feel good about.
Definitely. And if you have any questions or concerns about chickenpox, don't hesitate to reach out to a healthcare professional. It's always better to be safe and informed. A big thank you to our listeners for tuning in. We hope this conversation helped you better understand chickenpox. Stay tuned for our next episode, where we'll continue bringing you practical, easy to understand health topics. Until then, take care and stay healthy.